Hello, this is Dr. Steele. Today I want to talk to you about a subject that is extremely important, especially for men, but also women. So I'm talking about the deficiency of testosterone for men as we get older. Unfortunately, as we get older, not all men, but most men, especially in my case, which I treat diabetes, a number of my patients, they come in with low testosterone. And the reason for that is multiple. But most of the time it's because, as you know, diabetes is a vascular disease that affects our vessels, and those vessels get clogged because the blood's not going freely through them because of the sugar being high and the cholesterol being high, and so on and so forth. The damage to those vessels. So that can alter also how our gonads, or the site that produces testosterone, is being fed nutrition, so that testosterone tends to come down. And if it goes down, most of our patients experience the following. And let me reiterate the point. It's not only important to treat diabetes, but any other deficiency for the patients to feel better. So most patients, signs and symptoms that have low testosterone feel the following. Not all of them feel everything, but some of them feel multiple symptoms or one symptom. The first one is energy. If they have low testosterone, they feel less energy. They don't feel like they want to do anything. Not completely, but they don't feel as energetic as they used to feel. That means they don't like to work out. They don't feel like it because testosterone is low, as well as their sex drive is low. That's what I was talking about. We don't respect women. You men or your significant other, if they have low testosterone, cannot perform as they used to. As well as most of the patients feel sad, or they don't feel like, because it's linked to energies, they feel sad or depressed. And some of them even feel that they cannot sleep right. Also, the main complaint is, as I said, they don't feel sad, they don't feel as happy, they don't feel like they can sleep, but they also don't feel like they want to do anything every day. They're dragging themselves out of bed. And another symptom that they complain is that their body mass, their muscle mass, is going down. And it's more difficult for them to get to the right weight, not really waist, because remember, if you have more muscle, you weigh more. Not more, but it tends to, muscles retain water. So it's not good to say that the patient needs to lose weight. It's better to say they need to lose inches from their waist. So they start gaining more fat mass and less muscle mass if the testosterone is low. Another thing that I want you to keep in mind, that most patients with low testosterone, they feel, he says, let me repeat what I said: energy, sleeping not good, feeling not as happy as they used to, increases inches from their waist. They feel like they're getting more weight, they're losing muscle. But overall, they don't feel as they used to when they were younger. And of course, sex drive, right? I mentioned that. For that, if we want to treat it, we need to do some testing, make sure there is not only a primary problem, meaning the testicles, the Leydig cells that produce testosterone are the ones that are producing it. We also need to take care of secondary problems in the pituitary, taking prolactin, and tertiary problems, but that's something for us doctors to address. And the treatment always will be supplementation of testosterone. And remember, once we supplement that, it's not going to work right away because it takes time. Any hormone is not just like a medication. The hormone is going to activate cells to do what they need to do, so it's not going to be immediate. And in a few weeks, if not 1 or 2 weeks, people that are really deficient, they're going to feel the difference. And the side effects, I just want to mention a few. If the patient, unfortunately, some people abuse testosterone, they use a lot of it because they do want to gain muscle, like bodybuilders. Sometimes that can increase your red cell mass and make your blood more sticky or more. Uh, it doesn't move as it used to, and that can create a heart attack or stroke. But that's right. That's just only if you're abusing the testosterone. Another one, if you have severe prostate issues, it may increase the size of your prostate if you're abusing it as well. But that's my talk for today. Talk to your provider, your doctor, to see if you are a candidate for hormone replacement therapy, in other words, testosterone replacement therapy. Because at the end, we only have one life and we need to live it to the fullest.